for the next speaker is Dr. Gwen Healy from Akerok. She is the Executive and Scientific Director of Qaujigiartiit Health Research Center. Thank you.
I'm not Gwen Healy, but I will just say a few words to make the connection now to the Canadian presentation, which you have beautifully introduced. Once again, questions, comments will follow after this next presentation, so please save those up. Can I remind you, if you're not speaking, to go on mute? And now we are going to have the Canadian presentation, and similar to some of the others, we're going to have some multiple presenters, but not all in the same place. So we're going to see how this works. As Siggy mentioned, our first speaker is Dr. Gwen Healy Akerok, and she is going to speak to us from Iqaluit. So I'm going to ask Gwen to go off mute and to start the Canadian presentation. Over to you, Gwen.
Okay. Hello. Good morning. I hope you can hear me. Thumbs up. Okay. Good. My name's Gwen Healy Akerok, and I come from Iqaluit, and I'm the Executive and Scientific Director of the Qaujigiartiit Health Research Center here in Iqaluit. And if you could see outside our windowless room, you'd see the sun just starting to rise up. Or now it's up now because it's 11 a.m. here. But on a beautiful cold morning, and it's my pleasure to just sort of set the stage for the Canadian presentation. If I could just have the next slide, please. So I come from Nunavut, which is a very large region here in the circumpolar world. Our region covers 2 million square kilometers in northern Canada, and we have 25 geographically isolated communities in our beautiful land. They're only accessible by air and by ship in the summer. We have a little over 35,000 people living here and distributed across these communities, and 85% are Inuit, who are the indigenous people of these lands. And we're speaking 4 official languages: English, Inuktitut, Inuinnaqtut, and French. And we have Canada's fastest growing population, where we have the highest birth rate in the country, and the median age is about half our population actually is under the age of 25. So we have a very broad base in our population pyramid. Next slide, please. So our healthcare delivery model is distributed, and it's based on a remote nursing station model from around the 1950s that was implemented in different jurisdictions in the country. And our territory is divided into 3 distinct health service regions. So in the green there you see in eastern Nunavut the Qaujigiartiit region, and in the central part the Qaujigiartiit region in pink, and in the west the Qaujigiartiit region in purple. And so each of these regions has a different referral and tertiary care center hub located in an urban center in southern Canada or in Yellowknife in the Northwest Territories. And so each community has a health center staffed by a variety of healthcare providers, including nurses and community health representatives and other staff. And then there are 2 regional hubs in Rankin Inlet and Cambridge Bay that are sort of super regional health centers. They also include midwives on their staff. And then here in Iqaluit we have the one and only Qaujigiartiit General Hospital, which has a larger complement of physicians and a surgical team as well. Next slide, please. I think that's it from me.
Yes, thank you very much.
Thank you very much,
Gwen. Thank you, Gwen. So we, as I said, we're doing 2 sites for the presentation from Canada, and this next part of the presentation is actually a double act. We'll first be hearing from Stephen Tuart, who's the Territorial Director for Medical Affairs for the Government of Nunavut, and then from Jennifer Qaujigiartiit, who's the Senior Project Consultant for Northern Ontario School of Medicine. But I'll ask Stephen first to speak. Over to you, Stephen.
Thank you. Good morning. when Dr. DeVet and I flew down here on Sunday, it was minus 59 Celsius in Iqaluit, and so when we got here, it was about 50 degrees warmer. So we're happy to be in India. So we're just going to be focusing in today on past practices for starters in Nunavut, and starting with recruitment. So we see a high number of physician providers in Nunavut. In the range of around 250 contracts are issued every year. About, I'd say 180 are different physicians. And so we get a lot of short-term locum physician visits. So you could say that the coverage that we have up in Nunavut is strong, but it's not entirely appropriate physician service because there's a lack of continuity, or there was. And so that really affected patients negatively from a certain... Next slide, please. So as far as retention is concerned, initiatives were not really supported in terms of keeping people working in Nunavut and keeping them living in Nunavut. The focus was really on always scrambling to locate and employ service providers. And so the other aspect that really we noticed affected our MD retention negatively was that the contract model we were using was not quite right. Next slide, please. So as you all know, results of a lack of continuity, there's a risk for patients being undertreated, overtreated, and in many cases medical conditions are missed. There's also an increased likelihood with such a high number of physicians that there'll be a poor handover or poor patient follow-up practices when doctors are changing over, flying in, flying out, and oftentimes just meeting at the airport. And this all leads to, or led to, patient frustration. Next one. So also from the administrative standpoint in our office, the high rate of physician turnover there's extremely high travel costs associated with this turnover, also administrative costs, and our staff are not nearly as efficient as they could be because they're focused on recruiting constantly and putting together new contracts and all kinds of those items, when in actual fact we felt it might be, we didn't realize at the time, but retention for us and focusing a little more on that would improve things. And we, oh, sure. That's okay. So just a comment, we spent literally millions more on travel and administrative costs at the time. So that was part of that past practice. Next slide, please. So again, the focus was entirely on physician coverage metrics, and it did not consider how to support, improve conditions, or retain our physicians that we had on the ground. And that was the state of affairs at the time.
So when the Northern Ontario School of Medicine had an opportunity to undertake this project and related to recruitment and retention of physicians in the North, we reached out to the Department of Health with the government of Nunavut and discussed the opportunity to use the resources from this project to help them with what their priorities might be. And we were able to put together a great steering committee with key collaborators from Nunavut, including the government of Nunavut's Department of Health, Stephen Tuitt, who you've just met, the chief of staff at the time. The deputy minister of health was very interested in the project and delegated Stephen and the chief of staff to participate on our steering committee. We had representatives from the Northern Ontario School of Medicine, including Dr. Strasser and Dr. Penny Moody Corbett, who is our associate dean of research. We had Nunavut Tunngavik Incorporated, which is the Nunavut Land Claims Agreement Organization, or the Nunavut Inuit Organization. Since that time, they've also created an Inuit Training Corporation, Qaujigiartiit, and we have representation from that group on our steering committee. And two of them, Adeline Salamoni and Amaudla Kutu, are with Gwen in Iqaluit right now, participating in our call. We also have the Qaujigiartiit Health Research Network, of which Gwen is the executive director. And so that was our core group of our steering committee that we were able to sit down, look at this opportunity with, and identify some priorities with. And for some of our key projects, we also had Nunavut Arctic College, the regional hospital in Iqaluit, and the Department of Education involved. So after undertaking some baseline data collection, one of the things that we did was a retrospective contract review. We looked at how many physicians came and went from Nunavut in a given period of time, what was the duration, typical duration of those contracts. And that gave us some great baseline data to look at. And as Stephen said, it highlighted what they've already known, that there was some challenges in continuity of care and a lot of providers coming for shorter periods of time. And when we looked at all of that data, we also sent a survey to all of those same physicians and asked them questions like, would you consider, what did you like and what did you not like about working in Nunavut? Would you consider moving there? What would need to be in place to consider moving there? And based on all that information, our steering committee identified some key initiatives that fit under mostly the second two quadrants, or what do you call a quadrant in a circle that's divided in three? But anyway, the second 2/3 of the model. Under recruit, we said we discussed changes to their recruitment website. We discussed opportunities to look at innovative contract models for the physicians. And Qaujigiartiit Health Research Center has also been working on a cultural orientation app, which they launched over the course of this project and has become part of the physician welcoming package in response to some of the questions and concerns that came out of those surveys. We also identified the need for locally relevant professional development, continuing education and professional development for physicians. And there was an opportunity to host a health careers camp for youth. So these were the initiatives that were identified under the umbrella of this project to be undertaken in Nunavut. And so under the umbrella of Recruit, just to give you a little bit more detail on what we undertook, there's a brand new recruitment website that has been launched that Medical Affairs put together, and we're continuing to discuss how we can create a cycle of ongoing improvement of that website. We undertook an environmental scan of contract models that are in place for physicians in rural and remote environments in Canada and elsewhere, to look at, in places where they have a more stable physician workforce and more continuity of care, what do the terms of the contracts look like, and what are the elements of their sort of contract models that could be considered for adoption in Nunavut. And so that was created as a discussion document. And then finally, the schematic on the right is a representation of Dr. Healy's and her team's cultural orientation app, which people can download onto their phones and read first-person information from people in Nunavut about how they would like to be treated in their healthcare system. They can read information about how to prepare for moving to Nunavut. They can read about what the healthcare model looks like. And this has now been embraced by the Department of Medical Affairs and is routinely, automatically shared with every new physician when they come for a contract. The continuing education events, we hosted two. We worked with the director of the lead physician in Nunavut, who's the lead for medical education, on hosting two conferences in Iqaluit. And they were, the focus was on peer-to-peer learning. There is a pediatrician in Iqaluit, for example, who sees specialized and unique pediatrics needs in Nunavut that doesn't necessarily have a lot of opportunity to connect with all the family physicians on best practices and some current common issues, for example. So there was an opportunity for peer-to-peer learning and people to kind of build some collegiality, build social connections, and also respect and understanding of each other's areas of expertise and experience. And finally, another initiative that's sort of the upstream investment is, as we mentioned, in Nunavut, all of the communities are air access only. And oftentimes you wouldn't know that a career like physiotherapy or audiology exists unless you've been flown from your community because you have an issue that needs treatment by that profession. So we were able to leverage some additional funding from the federal government to host a Nunavut Health Careers Camp, similar to what we do here in Northern Ontario. And 20 youth from all over the Nunavut communities came to Iqaluit, where there's a nursing program and the big hospital, and had an opportunity to interact with a wide range of health professionals to promote the health careers. So all of these activities have been evaluated, and to greater and lesser extents well, Stephen is going to tell us about sort of what the future looks like on the heels of this project. But in addition to the specific impacts of each of the projects, we can say that for sure we've seen a lot of strengthening of partnerships, a lot of opportunity for dialogue around service improvements and around greater collaboration that likely would not have taken place without this project. And there is a new pediatrics residency position in Nunavut in partnership with the University of Ottawa and the Department of Health. I'm handing it back to you, Stephen.
Yep.
Have I been advancing my slides when it was supposed to be you? I'm sorry. I'm going to hands off that.
So from 2017 till now, it's been a time of transition and a time where we began to implement some of the new things we've learned. And we've shifted from fixed to flexible contract models. And really what we've done is opened up Nunavut to more job sharing, because we found from a lot of younger doctors that was something they were interested in, is living in southern Canada, but then also coming up and providing service to us in the north, in Nunavut, and specifically Iqaluit now, but it's spreading across the territory. Next slide. So as Jennifer mentioned, we had surveyed and listened to what physicians wanted. That's a picture of Iqaluit there, by the way, across the bay. It's a nice night. And so we listened to physicians, and we wanted to make sure that it wasn't just our full-time physicians, but also the hundreds of locums that support us annually. Next slide, please. So new initiatives. We began to increase our focus on offering local continuing education and professional development events for physicians. And recently, this year actually, started participating and hosting in intra and interterritorial events. So we're trying to get together more with Yukon, NWT, Northern Quebec, and Labrador as well. And we're trying to really form more partnerships and share ideas. Next slide, please. Also part of new initiatives, we've improved our focus on digital platforms. So we've revamped our website, so now nuphysicians.ca. It's still a light version of the site that we want, but we do have a vision for it, and we'll keep improving it as the months go on. Also, thanks to Gwen and her research team, they had put together that NU Health mobile app on iOS and Android platforms, and we really do use that a lot for physician orientation now, and it's an excellent tool to have. Physicians are on the plane, they're coming up, they can go on their mobile device, or even weeks before they can see and sort of learn what Nunavut's all about and what healthcare and practice will be like. Next slide, please. Also, we've placed a much greater emphasis on funding that we allocate to medical learners, and also the placements that we have for medical residents. And so as our secondary care center at Qaujigiartiit General Hospital in Iqaluit grows, we're realizing we need to be able to staff into the future more disciplines, and so we really started to open up different points where residents can come and participate and practice with us. Specifically, we're looking at general surgery adding on this year, in anesthesia, and I think going forward we will probably go into psychiatry and eventually start with internal medicine. So we're very happy about that. And of course, family medicine, which is our core. We still continue to have many family medicine residents come up, and it's been very successful. Next slide, please. So the three items that really stand out for us, success is predictability, continuity of care, and sustainability of the workforce for us. And that's what the results are from this project together, and we're very pleased with that and thankful. Thank you to all our partners.